What is endometriosis and how it affects conception? The name endometriosis comes from the word endometrium, the tissue that lines the inside of the uterus. If a woman is not pregnant, this tissue builds up and is shed each month. It is discharged as menstrual flow at the end of each cycle. In endometriosis, tissue that looks and acts like endometrial tissue is found outside the uterus, usually inside the abdominal cavity. Endometrial tissue residing outside the uterus responds to the menstrual cycle in a way that is similar to the way endometrium usually responds in the uterus. At the end of every cycle, when hormones cause the uterus to shed its endometrial lining, endometrial tissue growing outside the uterus will break apart and bleed. However, unlike menstrual fluid from the uterus, which is discharged from the body during menstruation, blood from the misplaced uterus has no place to go. Tissues surrounding the area of endometriosis may become inflamed or swollen. The inflammation may produce scar tissue around the area of endometriosis. These endometrial tissue sites may develop into what are called lesions, implants, nodules, or growth. Endometriosis is most often found in the ovaries, on the fallopian tubes and the ligaments supporting the uterus, in the internal area between the vagina and rectum, on the outer surface of the uterus, and on the lining of the pelvic cavity. Infrequently, endometrial growths are found on the intestines or in the rectum, on the bladder, vaginal cervix, and vulva external genitals, or in abdominal surgery scars. Very rarely, endometrial growths have been found outside the abdomen in the thigh, arm, or lung. Physicians may use stages to describe the severity of endometriosis. Endometrial implants that are small and not widespread are considered minimal or mild endometriosis. Moderate endometriosis means that larger implants or more extensive scar tissue is present. Severe endometriosis is used to describe large implants and extensive scar tissue. Endometriosis is a common yet poorly understood disease. It can strike women of any socio-economic class, age, or race. It is estimated that between 10 and 20% of American women of childbearing age have endometriosis. While some women with endometriosis may have severe pelvic pain, others who have the condition have no symptoms. Nothing about endometriosis is simple, and there are no absolute cures. The disease can affect a woman's whole existence, her ability to work, her ability to reproduce, and her relationships with her mate, her child, and everyone around her. If you are serious about knowing more and getting rid of endometriosis, make sure you check out this site right here. This site is helping thousands of people in getting solution to endometriosis in their lives. You can check it out instantly by clicking the link in my video below.